Well, awesome. Good after. Oh, okay. Here I go. Good afternoon, everyone. My name is Major Contessa Walls, and I am the company commander for the Military District of Washington Medical Recruiting Company. And we are joined by our lovely battalion commander, Lieutenant Colonel Kayla Vickers. I will get ready to have her just say, quick hello to everyone and thank you all for joining us. And then we will quickly go over the bio for our lovely panelist, Dr. Rhiana Saunders. Looking forward to having a wonderful discussion with you all. Colonel Vickers, would you like to say hello?
So I'll be real quick. First, I just want to say good afternoon, everyone, and thank you so much for joining us. And I cannot thank Dr. Saunders enough for agreeing to speak with us today. Her story is amazing and her accolades are wonderful. We both spent some time at BAMC, so great to see another person who's walked the walk and talked the talk at our Level 1 Trauma Center. But I think you guys are in for a sweet treat today. Looking forward to connecting with you all and wish you the best of luck in your process.
Awesome. Thank you so much, ma'am. And so we are here to talk about all things MedCore HPSP and who other than to be able to kind of give you all her personal experience navigating coming into Army medicine and then, using it as a launch pad, if you will, to do some amazing things like post-retirement. I think that happened in 2024. So I'll just quickly go over her bio. Dr. Rhiana Saunders, commissioned in the Army through ROTC at the University of Notre Dame, awarded an HPSP scholarship. She earned her medical doctorate from Georgetown University School of Medicine in 2004 and completed her gynecologic surgery and obstetrics residency at Madigan Army Medical Center in 2008. She completed fellowship training in reproductive endocrinology and infertility, REI, at the University of Louisville in Louisville, Kentucky, where our medical recruiting brigade is. She returned to Madigan Army Medical Center in 2012 as a core faculty physician and director of the resident research curriculum. In 2014, she assumed the role as a director of the REI division at Brooke Army Medical Center. And during this time, she deployed to Kuwait in support of the 31st Combat Support Hospital. As the REI division director, she spearheaded equal fertility care access to single soldiers and same-sex couples at Brooke Army Medical Center. In 2018, Dr. Saunders transferred to the National Capital Consortium, where she assumed the GS&O Residency Program Director position, and then she was awarded several different awards there. In 2021, Dr. Saunders earned an associate professor in gynecologic surgery and obstetrics position at the Uniformed Services University of the Health Sciences and transferred back to San Antonio, where she served on multiple graduate medical education subcommittees with a special focus on REI education. After 20 years of service, Dr. Saunders retired from the United States Army Medical Corps in June 2024 in the final rank of colonel. She has joined Aspire Fertility Houston to begin a new career dedicated to providing individualized, successful, compassionate reproductive care for all patients seeking to build their families. On a personal level, Dr. Saunders is a wife to her husband, Bo, and mother to 3 children, Evelyn, Amelia, and Kelhan. She and her husband are avid sports enthusiasts and loyal Notre Dame alumni, and all 3 of her children are actively engaged in competitive sports. Dr. Saunders, thank you so much for joining us. People who have a little bit of the purview of behind the scenes, I reached out to you via TikTok. Shout out to TikTok. And you were gracious enough to accept my message and be able to come on and join us. I'm just so excited for people to hear about your experience. And again, thank you so much for being here with us.
Yeah, well, thank you, Major Walls, for reaching out and inviting me here. Can you hear me okay?
Yes.
Okay, wonderful. So yeah, gosh, that was a big bio. I think I'd like to just start by sharing a little bit about like how I ended up where I am. I grew up a military brat. My father was in the Air Force, so I had some familiarity, before adulthood of what the military life was going to be like. I went to the University of Notre Dame on an athletic scholarship, and that's what got me in the door, I think, at that great university. But during the course of my time there, I realized I wanted to be a doctor, and I knew that with every fiber of my being. And I didn't have the financial means to support myself, nor did my parents through medical school, and trying to learn a little bit about that process, getting a little bit scared about the debt that I was going to incur, the amount of loans I was going to have to take out in order to go to medical school. My father had really kind of encouraged me to consider ROTC at the University of Notre Dame. And I don't know if anybody here on the call is familiar with the University of Notre Dame, but they have a huge ROTC program in both the Air Force, well, all the Air Force, Navy, and the Army. And so it was in my partly through my sophomore year, that I just walked into the office and asked a little bit about their program. And I expressed from the start that I wanted to be a doctor, and could I be a doctor in the military? And they welcomed me in, and it was a great experience. And 20 plus years later, I have zero regrets about that, about stepping in that door. I've had so many wonderful experiences. You saw in my bio, I've moved a lot of places. And in that, my kids have become really resilient, learned how to make new friends. But we've kind of a bit of an adventurous family. And I've met so many mentors, incredibly brilliant people that elevate you. It's who you surround yourself with and make you your better version or best version of yourself, and really instill not only the academic acumen, but the leadership potential along that 20-year career. And it's been phenomenal, and I have zero regrets. But my kids were at the end of my 20 years, my kids are in high school, and I wanted to kind of give an opportunity to settle down and stay where they were, and where my family is from. I did high school in Houston, and my family, my sisters, my father, all in Houston, so I wanted to come home, essentially. So that's where I landed 2 years ago upon retirement. But I can definitely talk a little bit more about HPSP and what that afforded me. When I was an ROTC cadet, I started a little bit later than my peers. They had already been through the ROTC program, knew the lingo, had the uniform, and already developed some of those bonds. But it didn't take long for me to fit in and catch up, and to become one member, enveloped in that squad. And upon commissioning, I was awarded the HPSP scholarship, and directly, from college graduation, moved over to DC and started medical school at Georgetown University. And I never wore a uniform during the 4 years that I was there, except for my summer trainings. But I really was there to learn and to become, a medical student, and to earn my MD degree. So I went through all the same courses that all the other students at Georgetown went through. And in the summers, I had the opportunity to spend rotations. The first summer was sort of like, they have a new term for it now, but at the time, officer basic course. And it was 6 weeks at Camp Bullis in San Antonio. And you're there with dentists and future physical therapists and other doctors, and you're learning how to be an officer in the Army, meeting new friends, lifelong friends. And then going back to med school, when the next academic year started back up. And after you went through officer basic course at that time, you now were in the next year eligible for rotations at one of the military medical hospitals or community hospitals or medical centers. And there was an opportunity for me to prioritize. You get a list of which rotations you want to do, what time blocks, what specialty, to get that exposure. And Georgetown lets you go and do those funded 6-week rotations. And did that twice. I did a rotation at Madigan as a medical student, and I did a rotation at Tripler in Hawaii. I knew over the course of my 4 years at Georgetown that I wanted to go into women's health. So I was able to select specifically those rotations in women's health at those two centers. And I had the opportunity also, because I lived in Georgetown, to go to Walter Reed. And even though it wasn't a formal rotation, I got to still be a part of their academics and do a couple calls on labor and delivery and so forth with the folks there, outside of, my medical school time at Georgetown. So I really feel like I got a good sense of what it was like to be a military officer and physician during the time on those rotations. It made me excited. In my senior year of my last or fourth year of medical school, you go through, your residency application process, and I'm sure every specialty is a little bit different. But at that time, there were 5 Army residencies in women's health that you interview with, you apply for, you interview with, and sometimes it's a phone interview, but sort of like your rotations on site are kind of like a 6-week interview, and you rank your orders. And I got, fortunately for me, my top pick going back to Madigan. I love my time there. And then you complete your residency. That's really kind of the start of my entire career at Women's Health. Was in a highly a high mentorship program. I had incredible mentors as a resident who promoted me to submit my research, to go to national, civilian conferences, who, sponsored personal growth, academic growth, research growth, throughout my training. And I had 2 of my children born in residency. And, the first day I went to go to my program director and tell him that I was pregnant, I was a little fearful of what they were going to say and how that was going to impact my training. And it was nothing but like support and congratulations from that. And I never felt like I was putting out my team members, or, relying on them to cover down, because when you're in the trenches, side by side with these other residents during that 4 years, you build real strong family bonds. And I'm still friends with those folks today. So I finished my 4 years, and I went out to be a general OBGYN for a year at Fort Campbell, which is a very busy hospital in Kentucky, and kind of really flourished as an independent. There's no other attending, no more attending. I was my own person for that year, and that was great. Learning side by side with midwives. They were phenomenal midwives. And that hospital center there, for the first time, owning all the decisions that I made. There was nobody else above me supervising me. And that was a great learning experience. I did apply to have an educational delay and go into fellowship training, which again, the military approved. My fellowship was 3 years at the University of Louisville. And so again, I took off the uniform for 3 years, was just a fellow for 3 years. I had to do an annual fitness test and turn in my scores. And I had to get an annual review from my program director, my fellowship program director, and turn that in to the Army. So they kept tabs with me every year, twice a year. But after the 3 years, I went back into the military and then picked it back up essentially where I left off, only this time now as a subspecialty trained physician. And then over the course of that time, as an REI doc, there are only certain centers that you can be stationed in that specialty. And it differs for every specialty. So I really had an opportunity to flourish back at Madigan, which is where I wanted to go. But then leadership positions open up. And you're encouraged to take them, and it's a great opportunity. It's growth and adventure. And so that's what made me kind of go through that process of leaving Madigan, going to San Antonio, going to Walter Reed, going back to San Antonio, because these new opportunities, develop over the course of your career. And each time I grew, I learned and was enveloped by incredible, brilliant people. So that's kind of my spiel.
That's awesome, ma'am. Thank you so much. And there was so much substance there. So thank you for sharing. I think just to like recap, so you did talk about how, that you essentially sought out the HPSP for that financial support. And that is something that is offered through the program. Definitely, we're sharing the flyers and we're talking about that. And there is now an increased stipend. So we'll definitely make sure that our listeners, have that information. But I also want to like really focus on too, how you talked about, that the family support and for you, like in terms of family planning, no pun intended there, like in
Yep.
terms of your career progression, right?
Yeah.
But I think that's something huge that folks definitely do ask about, for us, like, how much support is there, like in the programs, if we do want to seek out those different opportunities, which I think blends into where we often, the recruiters for sure, get questions about, will they be supported in terms of their, career endeavors as they want to, pursue fellowship opportunities. So thank you again for highlighting how that is something that they can apply for and be able to pursue. And then a big thing too that you talked about was mentorship. And so we definitely do try to tell the applicants as much as possible that, the Army is huge on mentorship, and especially in Army medicine. And so it's no better time than to get connected with some mentors early on so they can kind of help coach, teach, and mentor you in that process. So thank you so much for sharing that. I will ask, so what opportunities or leadership development teaching came your way in uniform that might not have happened on a traditional civilian track?
Well, I think, it is far few between those doctors who go into academia versus those who go out into private practice. Most folks in residency are going to finish get their graduation certificate and then go out into the civilian world. And most often it's either in private practice or a community hospital, but it's not in an academic center. And all of the OBGYN programs in the Army are in these highly involved academic centers. And not to say that you can't get that in the civilian world, but the proportion of physicians in the military that are still strongly academic minded, I think is definitely, a distinct advantage of being in the military. And maybe not everybody wants to be, academically minded. You're not pressured to publish or to do research, but it is a part of the culture. And it wasn't a comfort area for me. It's not something I did in college. I didn't have a research rotation or a research internship or block. And so it was a little bit unfamiliar and it was a little uncomfortable. But they don't just like put you in a lab and tell you to go. There's mentors there. They walk you through it. You get excited with what this fellow is doing or what that resident is doing, and they bring you up and they want to kind of train the person behind them. And that's kind of how that was my experience. So I think a lot of the academic and research opportunities were there. I don't think I would have done that if I had took a traditional path in the civilian sector.
Awesome. Thank you. And related, so what was hardest about practicing medicine in uniform, and how did you grow through that?
Goodness. Hardest? I so much has happened in the last 20 years. As part of my bio, if you saw, there were some things that we couldn't do, especially in women's health. We couldn't treat single soldiers. We couldn't treat same-sex couples, and that now is totally different. So there's been a lot of growth in especially for me and my experiences in women's health, that were kind of spearheaded, honestly, during my training and early attending years. So that's a little bit unique, a little bit nuanced, specifically to me in women's health, particularly in the military. Making it more applicable, there wasn't, gosh, if I were to be completely candid, in residency, it's really hard to keep up your physical fitness. You got long hours. You're on call at night. You're tired the next day. But even then, when I started residency, there wasn't that 80-hour work rule, and the amount of time that you had in the clinical realm wasn't really capped like it is now. We were truly sleep deprived. And that happened during my residency, this 80-hour work rule. And so that transition was there. And so there's a lot more protections now than there were, and that's civilian and military alike. A lot more protections on the safety of your physicians and their ability to make good decisions because they're sleep deprived in years past. I think that was a little bit challenging of just maintaining my fitness because every year you still have to take a PT test, and I always passed. But it was a stress for me to be like, I got to get back out there and make time and carve out either at the tail end or the beginning of my day to do that. Much easier once you're out of residency. Your schedule is your own and your hours are a lot less. So I think it's not necessarily military, but it's more just residency in general. It's a rite of passage for everybody.
Gotcha. Awesome. Thank you. And related to that, we're actually joined by our lovely brigade commander, Colonel Riley. And so he did drop in the chat. So Dr. Saunders, in my experience, Army's robust residency match process actually provides a more structured, supportive pathway to your desired specialty. So wondering, would you agree? Does it do so compared to the chaotic civilian match?
I think so. I think sometimes you can get overwhelmed with options. I think also there's a huge community behind, and it's hard for me to say because I haven't lived the civilian life in that training, development, and growth, but I have seen what the military has done through my collaboration and work with the Uniformed Services University, but even in those who are doing HPSP through civilian medical schools. I've seen so many like support groups in social media. You found me through social media, but social media and support groups and email chains and where they do reach out in women's health, particularly in the armed forces districts of the obstetrics and gynecology realm. Very strong, very robust, and a lot of promotion at the medical students. They are invited to our meetings. They get promoted and mentored and encouraged even to get involved with policies. So incredible amount of, I think, networking through that.
Awesome. Thank you. And we did have one question since we had just mentioned it. So I'll jump to it. So it says, I have a question for Dr. Saunders. You spoke about your father being in the Air Force. Can I ask about your decision in choosing the Army versus Air Force? Yeah. We love all of our counterparts, but I'm sure you anticipated the question. Yeah.
I'm going to have my biases naturally. Honestly, truth of the matter is it did come down to money. And the Army at Notre Dame had more easily accessible funds for me to not only become ROTC scholarship, but also HPSP scholarship. That said, after I made that decision, I learned about how many more in-house military Army specific programs had. A lot of the Air Force at that time, and I think in some specialties it still rings true, many of their medical students when they graduate are going to civilian residencies and then coming back and serving their time in the Air Force. In the Army, there are so many Army specific residencies that you kind of fill those tanks first before you're deferred out to civilian world. And in most cases, like the cream of the crop is what's going to the Army programs. I mean, they're the strongest and the best diverse programs. And so you want to go to the Army residency. And then when you spend your 6 weeks there on site, learning side by side with the military residents themselves, you kind of get in the trenches with them and you feel like, man, these are my friends. They know me and I'm like them and they're familiar. And you want to be part of them. It's like the A-team.
I love that. No pun intended too, like Army A, but yes, yeah, I love that. And I related, so also from Colonel Riley. So looking back, how did graduating without $250,000+ in student loans give you the financial and personal freedom to focus entirely on becoming an exceptional doctor, especially now as a specialized physician in your field?
Yeah. I mean, it's a huge financial stress can be a huge burden. I mean, so many studies out there correlating it with depression and strain and then marital discord or, all sorts of relationship problems. And that was not a thing that I had to deal with. I lived that growing up, that financial strain. When my dad got out of the military, there was difficulty there in my family, and I didn't want to live that, and I didn't want to have that. So it was a huge relief not to have that. At the same time, many people are building their families during these years, you late 20s, early 30s. Not everybody, obviously, but that was another burden. I didn't have to figure out how, we're going to be able to support the family at the same time while paying all these bills off. So that was a huge benefit. At that time, my scholarship programs did not have the same stipends that they have now. So I still had some loan, but not nearly the extent that many of my other civilian colleagues at Georgetown left with. Um, and so, with that extra money in your pocket, you can, I mean, if you're really savvy, you can start investing earlier and so forth. So it definitely gives a huge stress relief.
Awesome, thank you. And so we do have another question, and I'm jumping to the chat early just because it seems like people already read my mind and already saw the placement that I sent you with the question. So thank you all so much. Continue to please drop those in the chat, and we hope to be able to get to them. So one question from Ms. Cheyenne, I believe. So I'm a non-traditional applicant, and I'm piecing together my post-baccalaureate prerequisites while working full time. I'm also a parent and my husband is active duty. So I have some unique scheduling constraints. What advice would you give someone in my position who's preparing to apply to medical school and HPSP? Are there things you would recommend I prioritize now before I apply to make myself a stronger applicant?
Ooh. Well, there are definitely, and I wasn't in that boat. I didn't start building my family until residency, but as a program director, what I told my residents often was like, outsource. When your time is precious and you have only so much to dedicate, not only to your relationships at home, but also to your academic growth, outsource. And you have to trim the fat, so to speak, not to use a bunch of cliches, but, have somebody help clean your house. Don't take on that burden. Grocery shopping super fast now. I drive by, pick up. I don't need to waste an hour on Saturday fighting with my cart in the aisles at the grocery store. So things like that, outsource, hire the kid down the street to mow your lawn, or, things that you can outsource to give you back some of that time. A lot of growth. Now I listen, if you walk to school or you drive and you've got 20 minutes in the car, podcasts, you can get so much learning through just listen. I mean, if you are an audio learner, if you can listen and learn, but I learn a lot. I review articles through podcasts, so you're capitalizing on the small bits of time that you have between these other requirements and duties, that steal your attention away. But outsource and find other ways to learn if that time is not available to you otherwise.
Awesome, thank you. Colonel Vickers tells us this so much as also a medical professional. So it's almost like you read her mind. But then also, I'd be remiss without saying, shout out to my husband. We're also dual active duty military, and he's on supporting us. So I hope he heard that nugget there about we have to outsource. We have to outsource. So, thank you so much for that. I know someone did also say, I believe Dr. Sanders' bio mentioned a deployment during her service in the Army. So what was that experience like for you?
Yeah. Everybody's experience is going to be a little bit different. In women's health specific, we kind of have our feet in two doors. We can deploy as primary care physicians. We can also deploy as surgeons. And in each specialty, you have a consultant to the Surgeon General. And if you're savvy enough to develop a rapport with that consultant, I mean, they're going to be fair and equitable. They always are. But it's about having open conversations about, this is what's going on in my family life. This is the ideal time for me to deploy. Everybody falls on that sword. And if you can pick it, if you can volunteer for a particular, time in your life that's going to be best for you and your family, your consultant will try to listen to you and try to promote you. But they're always going to be fair and equitable. But they're usually, for the way it worked for us at that time, there was a roster. Here are all the potentially deployable OBGYNs. And you knew where you fit on that roster, and you knew your name was going to come up eventually. And when a spot came up for me, that was a good time for my family of like, if I have to go and deploy, this is the best time for me to do it. I had that conversation with my consultant and they made it happen. I personally would prefer to deploy as a surgeon than as a primary care physician. So again, I jump on the opportunity to pick that deployment. Now, I don't know that every specialty is going to have that sort of same relationship and capability and the way that they're structured or organized, but that's how it worked for me, is that I volunteered for that particular deployment. It was going to be in a surgical capacity, and it was in a place in Kuwait. I mean, that wasn't so bad. I had several folks, friends of mine that deployed to Iraq, that went to Afghanistan and to other locations, and their experiences are different. But for me, it was brick and mortar. I wasn't in a tent. It wasn't like MASH. I operated, and I was operating next to a colorectal surgeon. And I learned so much, and how they would critique, how OBGYNs do it. And we would critique how surgeons do it. And we learned from each other. And it was a wonderful experience. I learned so much, and my skills got that much better. And my calm, usually OBGYNs are pretty calm. We can handle chaos in an operating room with a C-section and all that stuff, rapid fire. And we can handle hemorrhage. We've got that, but I think it still elevated me to be in that situation and develop that skill set. So you opportunities will come, and if it works for you, volunteer for it. And you pay it forward because the next person behind you is going to do the same. And that's kind of the community that I worked in, and everybody knew each other. There were 2 a.m. I am in Kuwait, and I'm seeing something for the first time I've never seen before. I don't know how to handle it. And I am calling my friends in San Antonio. It's 2 a.m. and they pick up the call and they help you. And that actually happened on more than one occasion. So I mean, that's the environment I was in.
That's awesome. Thank you. And I'm a psychologist by trade, but we also tell folks as the same thing, like looking to come into Army psychology, that if you want to kind of do something very niche and kind of boxed in, then maybe, the Army is not for you. But if you really want to broaden and really stretch and grow as a clinician, you certainly are going to have the opportunity to do that. And it sounds like the same goes like on the physician side for sure. So thank you for sharing that. Related to that, Colonel Riley even says, so how did that early exposure to leadership, leading clinics and leading medical teams set your head and shoulders ahead of your civilian peers when you transitioned?
There are the worker bees, and then there are the leaders. And a lot of folks just go and they just want to do clinical. They just want to do clinical, and they just want to see their patients and go home at the end of the day. But I have been in this civilian job for just a whopping 2 years. But in the leadership, they're not coming in and like, pushing people or elbowing people out of the way, so to speak. But I have valuable insights to lend, and we have monthly meetings. And so kind of carving out a little bit of space for yourself for when there's troubleshooting, or there's workflow that needs to be more efficient, or there's uncomfortable conversations because there's discord between certain members in the practice, and you need to be able to navigate and facilitate difficult conversations when there's disagreement. These are type of the leadership skills that you get, of like how to resolve conflict, and how to streamline processes, and be resourceful, how to cut costs in a way that's not going to skimp on safety. And these are the kinds of decisions that you just develop over the course of your military career. And so you land in a civilian spot, you have those experience already under your belt and can contribute meaningfully for when those things happen.
awesome. And so we did have one that definitely comes up a lot. So how does HPSP compare with going to, say, the Uniformed Services University in terms of financial benefits, military obligations, and the medical school experience? If you can kind of speak to what kind of helped you maybe decide between those options.
Yeah, honestly, my later couple of years were with USU HS, so I had a great encounter with so many students. They're really smart, really dedicated at USU. My experience obviously being different. I wouldn't necessarily put one above the other. They're just a little bit different. I think the USU experience, you're wearing that uniform. You live and breathe it every day. And you see, the fruits of your labors, like you're helping the military families or the military service members, which we don't necessarily get in the civilian sector. You learn military lingo, military medicine. You do more exercises, and you have probably more military specific mentorship. That is dedicated not only to your physical fitness, but also to taking on other leadership positions, either in your class or in your societies. Like I said, the Air Armed Forces District is huge, and you get more word of mouth through USU. It's not that it's not accessible in the civilian sector, it's harder. And you kind of have to just start making a network of knowing people in order to feel connected and informed and abreast of what's going on, what's happening now. So it is accessible, it's just harder to get in the civilian sector than it is living and breathing in uniform at USU, where, the mecca of all military medicine kind of is housed there as far as educational military medicine. HPSP though, you have touch points. Like I said, you still take your physical fitness test, and you still have to go in the summers either to your officer training, or you have to go do your rotations. Your actual, is it internal medicine or general surgery or whatever elective it is, you have to do these rotations, usually at a military hospital. So those are your touch points. You're putting the uniform back on, and I have some funny stories about that. When you don't live and breathe it, and you show up in the wrong uniform the first day. So it is a little nerve-wracking the first time. You're like, wow, it's been 9 months since I put this thing on. And it's a little bit, you just feel a little disconnected your first couple of days, and then you get into the groove. Like I said, you're in the trenches with them after a day or so. So there are like separations of, like, you're just living the civilian life for 9 months, and then you go into your rotations. So there are touch points. It's just not the same.
Awesome. Yeah, thank you for like noting that difference too. And I mean, I know folks have, done their research. So, the unfortunate part is that, Uniformed Services University doesn't have like infinite amount of seats. So there's definitely more, civilian schools out there. So if one would say, like, more opportunities for HPSP, but definitely staying connected with your mentors and your network to make sure that you are primed to be able to come back onto full-time service. It can happen, and make sure that folks are prepared. So thank you so much for that. I know we did talk a lot about in prepping for this conversation, just because I know a lot of folks kind of ask about this. The military can be seen as a launch pad, especially in Army medicine. So you may opt to come in and you want to do, finish out your ADSO, which could be like 7 or so years. But you may decide to have a long, career like yourself in 20 years. So, how did skills built in uniform, with regard to leadership, adaptability, working under pressure, how did that carry over into civilian practice?
Oh, I mean, like, I feel somewhat a little bit more like a newborn because it's only been 2 years compared to my 20 plus years of military. But there's just an inherent confidence. Whether I would have gotten that in 20 years of civilian service, I don't know. But I definitely, like, I don't sweat it. No, it's never going to be as hard as it was when I was a resident with 2 babies. I like you just develop a certain level of grit, and confidence, and nothing's so dire that you have to panic. And if it is serious, you can breathe through it, and you got a network of folks who you're not alone. Realizing you're not alone. You've got, like I said, 2 a.m. All the way from Kuwait. People are waking up. You're never alone. So if I run into a civilian problem here, in fact, I do, like sometimes medically managing some difficult fertility patients that I have now, I'm reaching out to my Air Force colleague that I met in my time at BAMC. Hey, I have this interesting patient, and we have not worked together in 10 years, but we have each other's cell phone and we call each other about interesting things, interesting cases, or difficult, challenging cases. So you have a network that you develop, and it's lifelong. And then, like I said, the skills, like in civilian practice, not every civilian practice has this capability, but we have residents that we still work with here, and we have medical students. I had a Texas A&M medical student rotating with me today. And so you learn how to educate, you learn how to counsel and to teach, and we have a break between patients, and I know what they need to know, and I know how to not just tell it and spoon feed it, but get them to think critically. And so you learn how to educate, you learn how to teach, because it's not like grade school where the teacher's at the front of the classroom spewing out information and the kids are in the desk taking notes. Like, this is getting them to think critically through difficult cases and prompting them by questioning, not in a threatening way, but in a way to like make them maybe second guess themselves and think deeper, and just prompt critical thinking. So you learn how to educate as well.
Awesome. And so we are curious, like, are there opportunities through Army medicine or military hospitals for prospective HPSP applicants to shadow physicians or obtain observation hours, like as they're looking to kind of take that next step?
Oh, I haven't had as much experience in that in a long time, but I know there are certain, Georgetown for one, several of my classmates were also, four other classmates were also Army HPSP. Class of 80, that's five. That was significant. So several, university-based hospital systems are going to have HPSP students. And sometimes it's just a cold call and asking. Even their residency programs. Hey, I'm a student interested in X, Y, or Z. As a residency program director myself in the past, I would have loved an interested, enthusiastic student and partner them up.
Awesome. Thank you so much. And so looking back, how did HPSP and Army medicine change the trajectory of your career in and out of the Army? So you're doing like some amazing things down there in Houston. Again, we'll make sure that folks have the channel information, like on TikTok. Me personally, I'm benefiting from all the education that you and your colleagues are putting out. So yeah, how did that kind of help shape where you're at now?
Yeah, I knew I wanted to be a doctor. Like I said, in college, I thought I wanted to be a surgeon. I go through my civilian medical school training at Georgetown, and in that training, you'll rotate on all the different services. But it's through that I really developed this passion of women's health. I wanted to operate, but I wanted to do women's health. And at first, I thought I wanted to do GYN surgery for cancer, GYN cancer. And so you go into residency thinking this is my path, and then residency hits, and all these experiences just impact or influence you in different ways. And so I would say to anybody, keep an open mind. Every time you're on a different program or a different rotation, just pivot and embrace that. Learn what you can from that, from the mentors, the educators that are there. Why are they passionate about high-risk pregnancy? Why are you passionate about pelvic floor reconstructive surgery? Why are you passionate about fertility or cancer? Like, and learn and embrace that. And that's what you do over the course of your 4 or 3 or 5 years of residency, however long it is. And let that reflect often. If you're a journaler and you kind of get your thoughts out, really reflect on what really drives you and what's going to make your life the most meaningful. At the end of the day, you have to love what you do when you put so much of your heart and soul into it. So I let that influence me. I didn't realize what I wanted until it was kind of too late. My chief year of residency, that window of opportunity to go straight into fellowship had passed. And that's why I went out as a general OBGYN. Zero regrets on that. I definitely have residents when I was a program director who wanted to go straight through residency, fellowship, and they had their whole life planned out. Things happen. For me, I felt like that was a huge year of growth, of being on my own 2 feet. Nobody was supervising me. I had to call the hard shots. I had to do the 3 a.m. hysterectomy on a 19-year-old. Like, I had to do these things with a midwife to operate with me. I had to manage the hemorrhage. I had to do these things. And it was a huge amount of confidence and growth in my skills. And then when I went into fellowship, as a fellow, you are also sometimes a supervisor to residents, to medical students. And that year by myself gave me the footing that I needed to be the best supervisor for others. I had to know how I wanted to do it first before I could make sure I feel comfortable watching somebody else do it. And so that year as a journalist was great. And I wouldn't have taken that back. I know other people go straight through. But for me, that was great. And then over the course of your time, you just be open-minded to these things. When I went out into civilian practice for my fellowship, because there really was only one fellowship program for the Army at the NIH for fertility care, you had to look at other civilian programs. I learned a lot about inner city health that I wouldn't have gotten in the military. And so I valued that. What I got out of Louisville was inner city health, taking care of incarcerated patients, things that were eye-opening to me that I had never seen, the amount of patients with, say, drug overdose, and things like that. Not that you don't get things like that in the military, but it's much less common. And so that was a great learning experience there too. And then I brought those skills with me when I went back into the Army. So the next time I saw something like this, hey, I had some familiarity with it. I knew how to handle it. So those are, you never know what path or journey you're going to take, and just be open-minded a little bit. I'm not saying it's totally like throw caution to the wind and go with the flow. Definitely have something that drives you, a passion, but be open-minded when those windows open, when those doors open.
Thank you. And so this is a big one for sure. But what would you tell a student today who's weighing HPSP but worried it might limit their long-term options?
Well, I definitely have folks ask me limiting long-term options. I don't know that I agree with that per se. You're right. Not every medical student is going to get their first residency pick. Not every resident is going to get into fellowship, but that is true for the civilian world. So that is not unique to the military. Those that are the strongest applicants are going to have the highest likelihood of getting what they want, the specialty they want, the location, the program that they want, and the opportunities for fellowship or research or whatnot. So that is not unique to the military. You don't always get to pick your duty assignment and where you're located. So there are some of those types of aspects. If you are caring for parents that live with you, I've had residents who, because they didn't have the financial burden of medical school, could care for their parents, and they lived with them. So like they're not. I had folks that say to me, they're worried about limiting options because I won't get to choose where I live, or I won't be able to choose my specialty and things like that. But I would say to you, that's pretty much the same in the civilian sector. If you don't get the program that you want, you might have to move across the states to a location you've never even considered because that's the only program that accepted you, or you might have to uproot your family. And that is true in the civilian sector. In the military sector, the amount of centers are smaller, but there's one at Madigan in Washington, there's one in Hawaii, there's one in San Antonio, there's one in DC. So we're kind of like on the outskirts, and then there's one, at least for OBGYN, in North Carolina. So there may be less centers to apply for residency, less locations to choose from residency. But I kind of flip that question around, that is not unique to the military, limiting options.
Awesome, thank you. And so we did have one that came up too as well, like especially in light of talking about family planning. Corbin says, I'm a new father to a 5-month-old son, so HPSP feels like it would be a huge help for my growing family. He asks, have your kiddos mentioned any advantages or disadvantages they gained from their time as a military dependent?
So my oldest is in college and we are in Houston, and none of her colleges that she applied or wanted were in Texas. So she was totally open to moving anywhere, and so adventurous, and strong and independent, because they have to build that level of resiliency when they move. My oldest moved 7 times, my youngest much fewer times. But there is an ability, a social awareness and comfort, and maybe it's hard earned, but as adults, they flourish, you know.
Awesome, thank you.
Yeah.
And so, yeah, no, that's perfect. Like you said, that grit, right? Like it's
Yeah.
definitely developed for sure. One person does ask here, and I'm sure that they would benefit from getting this information from you. So, what is the single best advice? Ooh, we could probably say top 3 best advice that you were given during med school or residency that you have reflected on, even at this stage in your career.
Oh, I'm gonna come back to that. I'm gonna go back to that previous question.
Okay.
Other opportunities, BAMC has a huge program, and I'm sure civilian hospitals do this too, for the youths, military family members. And my kids got to volunteer at BAMC. My oldest now is pursuing a degree in biomedical engineering, and she got to go and work with orthopedics and prosthetics at BAMC. And that's what kind of like spurred on her passion. That's what she's doing now. So a lot of opportunities there. Uh, so kind of taking that and pushing that over to the next question of like, the best advice I got is don't sell yourself short. Don't think you can't do it, because you can. Um, and I think at first I grew up in a family where you did what you were told, you didn't ask questions, you didn't, you never talked back, you ate your dinner. Like it was a very strict upbringing, and I think at first, when I start my residency, I want to keep my head down, do my job, and I always just went on by merit. I didn't learn how to make the actual personal connections with the leaders because I was intimidated by them, just like I would with my parents. It wasn't that I wouldn't, I was going to say bad things about my family. It wasn't. I had a great childhood, but it wasn't that like, I didn't have that level of camaraderie with my earlier years that I do now because I didn't ask. I didn't ask for promotions. I didn't ask for opportunities. I didn't capitalize them because I just wanted to be recognized, um, and hoping somebody would push me up. Um, and so I think I got there, but it would have been, and I see this now, maybe it's just a generational thing, where I have trainees question me, and or ask for opportunities. And the worst that I'm going to say is no, not today, or no, that spot's taken, or no, I can't do that for you. And they take that easier. And I was always scared of that rejection. And so I don't think I put myself out there as often as I could have in my earlier years. And I definitely had opportunities develop, but I would have gotten a better head start if I was a little bit more proactive and confident in approaching leadership. And so I think the 2 best pieces of advice is don't sell yourself short. You can take it. You really can. And nobody throws you in with the wolves. Like if somebody's saying, hey, I think you would be great for this. They recognize a potential in you. Trust in that. Somebody saw that you had this potential. Believe in yourself if they do. And they're not going to throw you to the wolves. If they think you're going to swim and not sink, they're going to give you the tools to swim. They're going to give you the net resources, the network, the folks that are already in the trenches 2 steps ahead of you to draw from their experiences. And so when they promote you to be a part of this committee or take on this leadership role or serve as the chief resident, you really can do it. There's usually a playbook, somebody who's done it before that you can learn from. So don't sell yourself short. Say yes when opportunities arise, because you never know what type of opportunities are going to follow on. It's a snowball effect to the positive. This door opened because of that door, because of that door, right? And so say yes, and ask. Like, go out there and like have a relationship with the people who make decisions on your behalf.
Awesome. Thank you. I do want to try to figure out a way that I can get Colonel Riley and Colonel Vickers spotlighted so they can, just help us kind of close out. And I'm sure they definitely want to thank you for your time. But while I figure that out, I'll throw another question at you. So, ma'am, civilian physicians in high demand specialties often pay tens of thousands of dollars annually just for malpractice insurance, and many are forced to practice defensive medicine out of fear of personal lawsuits. So can you explain the immense peace of mind that comes with practicing Army medicine, specifically how the government shields its doctors from personal malpractice liability and covers all insurance costs, and how that freedom changed the way you cared for your patients?
Yeah. Oh, this is a great question. And I could probably talk longer than you need me to, but the hardest part of what I do right now is money matters. The hardest part of what I do right now is trying to help patients afford the care that I can provide, and insurance authorization, or they can't afford this, and what other resources or grants. And like the military, I never had to worry about ordering an MRI because I think it was the right thing to do. It was the right thing to do. It happened. Right here, the patient can't afford it, and so I got to find a substitute. And I never had to do that in military medicine with the medicines that I needed. There might be a prior authorization through TRICARE, and that happens. And I didn't have to do that. Either my pharmacy tech or my nursing support helped with that. I never had to do that. And I never had to pay for my own, and separately, but also related, is my own malpractice insurance, but I never had to do. So leaving the Army, there's in retirement, you go through a huge kind of out processing part where they really do try to help support you in transitioning to civilian life and educating you on like things you've never had to think about before, contract negotiations. And oh my gosh, I've never had to worry about malpractice insurance. So they do have a lot of support as you're exiting the military too, after a long career, of making sure you find your footing when you step into civilian life. But so that was a nice escape from all of that during my years. And then now, I had that transition. I had the help getting set up with my contract negotiation. And so, yeah, I found my footing, but it still permeates my day to day, just in ordering tests or medicines or treatment plans for certain patients that you never had to do before.
Awesome. Well, thank you so much. We're at 2 minutes. So Colonel Riley, would you like to just hop on and say a couple closing words, and then I'll give it over to Colonel Vickers. Oh, you got to unmute, sir. Sometimes, yeah.
Hey, Dr. Saunders, this is Sean Riley, the brigade commander. I just want to say thank you for taking time out of your busy practice to come really raise awareness for all of these potential candidates. Again, thank you for your service and the time that you served as a provider and as an officer. Obviously, you've had a wonderful career, and super excited about where you're at now, just based upon the experiences that you had, whether it was in garrison, in our medical treatment facilities, or in a deployed environment, and then now as a successful civilian practice. So congratulations to you. I think you are the poster child of really what I think success could really look like for a lot of our candidates that are listening in today. So again, thank you. Just like you said, money piece. So taking you out of your practice for an hour is super generous of you. And we just really can't thank you enough for how you continue to tell your Army story and promote Army medicine, and while showcasing all of the great benefits that the Army has to offer some of these candidates that are looking into this field and wanting to make a difference, but have so many things weighing on their mind and their hearts and their chests in terms of financial liability, and a myriad of other things that I'm probably not even thinking about. I certainly know as a advanced practice nurse, I have just the utmost respect for all of our physician counterparts and partners. And again, whether it was you or any of the other providers, it certainly made me a better nurse working with leaders like you. And again, just can't thank you enough and wish you all the best as you continue to lead in the civilian sector and make a difference for your patients. If and when we can cross paths or somehow, we'll make sure we get one of these to you. So Kayla or Contessa, when I'm up there, can talk about this. Dr. Saunders, or
Thank you very
place it
much.
somewhere, but we certainly owe you a small token of our gratitude for being on the showcase today. So thanks again, and
Thank you.
God bless you and your family.
Thank you very much, Colonel Riley.
Colonel Vickers, you want to close this out, ma'am?
Absolutely. So I told you guys you were in for a sweet treat, and this was absolutely phenomenal. So I sat here and I took some notes just to make sure I captured everything that you kind of walked us through. And you talked about how you came into this like looking for an opportunity to pay for school through ROTC and medical school, but then you left with a sense of service. And that's the word I really want to hang on, is that you got school paid for, but it was really the relationships that you built, the time that you spent with your peers and colleagues, and that service that you were able to give back to your nation that really carried you through those next 20 years of being able to retire. Then you talked about the broadening opportunities that you experienced, and I definitely can appreciate that. The Army sent me back to get my MBA. I did my residency through the Army as an Army optometrist, and I was exposed to so many more things so much sooner in my career than going the civilian pathway. And then being able to be an academic and sustain that all the way through retirement, and even now being able to teach. So I just want our applicants to take that into consideration. And then the exposure that you had for your family. So I'm dual military, and so my kids will let you know. I think the father of the 5-month-old, you can appreciate your kids will let you know. They'll get that itch when it's time to move, and they'll say, "I'm ready to experience more." And it makes them that much more resilient when they're older. They tend to flourish much more faster than their peers. And so I can appreciate those stories that you talk about with your family. And then lastly, I took away, you said to not be afraid to ask, and then to always say yes. And sometimes saying yes can be the hardest thing. But I always tell people, take on the next responsibility, the next job, because you never know where you'll end up. And I think Dr. Saunders is a perfect example of that story. And so I'm excited not just for our future Army physicians, dentists, medical professionals who are on this call, but I'm also excited for you, Dr. Saunders, as you experience part 2 of your life. And we don't often talk about retirement and how you transition into the civilian sector. And that's also just as special as the time you spent in service. But the Army has set you up so perfectly to be able to enjoy that part of your life. So thank you so much for the time you spent with us today. And thank you, Contessa, for putting this together. Another well done webinar. And it's such a pleasure to be with you today. Thank you.
My pleasure. Thank you, Colonel Vickers. Thank you, Major
Thank
Wells.
you so much. Yes, thank you so much, ma'am. And I'll reach out for sure. But thank you so much. Thank you all so much for attending. And we will make sure that you have the recording, and we'll be in touch to be able to answer any more questions. Have a great day.
Thank you.
Not bad for